Okay, Dr. Toyin, it's all over to you.
Thank you, Arnold. Hi, everyone. So as Arnold said, my name is Toyin, and I qualified in 2014 from the University of Manchester. And I think my journey into dentistry and journey through dental school has been quite interesting. So there's lots for me to share, but I'll start from the beginning. So A-levels, I did the usual. I did biology, chemistry, maths, and sociology. I just wanted something interesting in the mix there. And applied for dental school. And even though at that point I didn't have what the requirements were, fortunately, I still managed to get an offer from 3 out of 4 dental schools and that I applied to. So with the A-levels, I really enjoyed it, but I made sure I had enough time to really do a lot of extracurricular activities. And I think that was the strength in my personal statement. And I think that really supported the academic side of my application. Because I might not have had all the qualifications or criteria on the academic side of things. So being really fortunate into getting into dental school, it really was something that I was very excited about. And dental school had its challenges for me, but in all of it, I did learn a lot in terms of the clinical side of things. But in terms of when you get into actual dental practice, it can be quite difficult if you're not used to being someone that can think quickly on your feet. What you learn in dental school is what you apply into general practice and in hospital, and it can be quite different. I think I'll touch on that later, but what I'll talk about now is my journey through dental school. So starting off with that, in terms of what you study, you are looking at general sciences. So you've got your biology, you learn about human anatomy and all those things, as well as when you get into it depends on the dental school actually. Some dental schools may start quite early in the process where you actually get patient contact quite quickly. It may be different. So for my university, the first 2 years were very much academics, and you're learning about physiology, anatomy. You get to do some interesting things with the human body, and yeah, you really just learn the general sciences, so you feel like a medic at that point. And then by the time you get into 3rd year, that's when you start to get the patient contact, and you get to do examinations on patients, and you're starting to feel more like a dentist, and you just build on those skills throughout. So by 3rd year, I'd seen my first set of patients, and by 4th year and 5th year, I was really starting to feel like a dentist and doing lots of interesting things. And the reason why I felt like you're in dental school is quite academic. You're studying, even though you're seeing patients, and you feel like a mini dentist. When you get into the real world of dentistry, you realize that it's different. I don't know if any of you have had jobs, but I think jobs are a great way of developing people skills, and dentistry is all about that. So when I got into, when I left dental school, got my first job, my training job, the thing that I would never forget is on the first day, I'm seeing my patient, and you learn everything in dentistry. So I remember this patient had gum disease, and so when we're trained in dental school, you look at the numbers, well, you check the patient's gums, and then you give the patient almost like a score. And I told the patient his score, and I said, before I do any other treatment on you, I think it's really important that we work on the gums. And the patient kept saying to me, I don't want to talk about my gums. I just want you to fix my problem. I've come with a broken tooth. But I was like, we need to go through this order that I've learned, and this is the right way to do it. And he was like, no, just fix the problem, and that's it. And I remember my trainer saying to me then that as much as dentistry is about the stuff that you've learned in dental school, the only way you can really thrive as a dentist is if patients trust you. And that means you have to build relationships with patients. And I think that's the one thing that I've really taken away from my experience as a early dentist, that is still what is helping me now. I think for dentistry, you have to be a people person. And if you can relate well with people, you can engage with people, and you can start a conversation and connect with people, then that is the main thing that will really get you far in dentistry. Because all the other things, learning all the clinical side of things, that's more, you know, learning about all the sciences. It's the same skills that you use for your A levels and in dental school, but when you get into the real world of seeing patients, that's when all your work experiences, if you've done volunteer work, that's when those skills really come into play. And me personally, I love dentistry. I love the fact that it's creative and you get to problem solve every day. And I love the patient interaction. You will often find that there are a lot of people that are afraid of dentists. And I think most of it stems from either bad experiences with other dentists or the things that the media portrays. Most people, when they think of a dentist on TV, they've got a negative image of a dentist already. So in that sense, our job is made more difficult. When you have a patient coming through the door, they're already probably on edge and a bit anxious, and so that's when, if you've got a friendly face and you're smiling, and you're naturally just a caring person, you can connect with a patient, and you don't actually have to talk about dentistry to start off with. But yeah, it's all about building relationships and making patients feel comfortable, because the dentistry is not actually the center of what you're doing. The patient is, and you know, being caring and managing their expectations is the most important thing. And just to sum it up as well, in terms of my journey, so since qualifying, I've worked in quite a few different dental practices, and I've also worked in 3 hospitals. So I'm not sure how familiar you guys are with the different options within dentistry for careers. So you could either be a hospital dentist, which I'd say it's quite a popular and competitive route, but most people end up working in general practice. And actually, I wasn't quite sure what I wanted to do within dentistry initially. But after doing my first year of training in general practice, I decided that I wanted to get some hospital experience. So the first job that I did within the hospital was oral surgery, so mainly teeth extractions and some orthodontics. So that was really good. I enjoyed it, and I thought, actually, I might go for another year of hospital training. It's quite a competitive process, so you don't necessarily get your first choice of jobs. But I was quite fortunate in the fact that I got the next job that I got within the hospital was really varied. So I got to do lots of different specialties. So restorative dentistry, special care dentistry, oromaxillofacial surgery. And yeah, it was a really good range of specialties that I covered in that time. And so within 2 years of hospital training, I was able to cover pretty much every dental specialty there was. So in terms of, if any of you guys are interested in a particular specialty, then in the Q&A session, definitely ask some questions and I can really explore those in more detail. But I'm grateful for the fact that I've been able to explore those specialties and see what I really enjoy within dentistry. And I think I'm a bit of a special case where I love everything. There is not one part of the job that I haven't loved. So yeah, I couldn't really decide what I wanted to do after doing the hospital training. I did actually apply for further specialty training because I thought I wanted to be a prosthodontist, which is where you deal with crowns and bridges and all the complex tooth wear cases. But I don't think it was for me. I don't actually think working in the hospital is where I thrive best, because I really love being in general practice, where you just feel like you're your own little boss. You're in a surgery and you've got your nurse as the person that you're working with, and it's a lot more controlled, I find. So I enjoy general practice. So after leaving the hospital, setting, I went back to general practice. So I was working in the practice that I originally started my training in, and I stayed there for a year. It was a NHS practice, very large. It's 10 surgeries in total. Really busy, lots of NHS exempt patients. I got to do lots of treatment, and I loved that place. I really, really loved the team. I loved the patients. It was close to home, but I felt that I really wanted to explore more of private dentistry. And so one day I just randomly applied for another job further away from home. And that job is in a really good practice. It's quite a competitive job process that I had to go through, but it was definitely worthwhile. And I got the job. So now I'm working in a really nice practice. It's still NHS based, but the NHS part of it is a lot smaller. So I get to do a lot more private dentistry. And I feel like that's more me. I pay attention to detail. I almost see myself as a visionary. So if I see a patient come in the chair and they've got an issue, I'm already thinking, okay, I can see how I can improve your smile here. And it's a great way for me to really kind of use my creative, artistic side, working with the patient to create a smile that they're going to be really happy with. So I think for me, private dentistry, cosmetic dentistry is where I've decided that I will settle and really build my skills in. So yeah, that's me in a nutshell. I won't ramble on for too long. So yeah, we shall talk more when we go to the Q&A.
Still got a few more minutes, about 2 minutes, 3 minutes. But I ask you, what are some highlights from working as a dentist? Any specific cases that come to mind?
I'll talk about one highlight from general practice, and then I'll talk about a case that I really, really remember and has kind of really paved the way for how I think about what we can do as dentists. I'll talk about that after. But yeah, one patient that comes to mind, she was really anxious, almost in tears, just coming into the room. The first time she came in for a checkup, we didn't even do anything related to dentistry. I remember she was so anxious. She'd had previous treatment when she was a lot younger. You might find that with patients, the ones that are really anxious, they've had lots of dental treatment. And they always kind of say that the dentists before you guys, they were a lot more heavy-handed. They did a lot more treatment, and sometimes it might not have been the most, the treatment might have been a bit much, so that you might find there's a group of patients that have had lots of treatment and they're anxious. And so that's an example of this patient. So she sat in the chair and I just thought, really, I can sense that she's not comfortable. She's almost in tears. So I just said, let's just have a chat today. And we won't talk about anything other than getting to know each other. So we just had a chat that session. And I said, next time you come in, let's talk about what's actually brought you in today, and we'll take it step by step. So the next time she came in, I was able to do a checkup on her. We spoke about her problems, and then literally we just had to go really slowly and do a bit by bit. And each time she was feeling more confident, I could see that she was just more herself, more relaxed, more bubbly. And I just made it an effort to discuss the things that bothered her about dental treatment. So she said she didn't like the drill, she didn't like the noises. So when we did treatment, anytime I'd say, bring your earphones in, just listen to music. And when you're in the chair and I'm doing anything and you don't feel comfortable, you just stop. It doesn't necessarily have to be because you're uncomfortable. If you just want to break for the sake of it, we can do that as well. So I think that allowed us to build a good relationship on trust. She felt comfortable in the environment that was in. I had the same nurse every time, so she was part of the team, making her feel comfortable. And we didn't actually do much treatment on her. It was a few fillings, but the reason why that really sticks for me is because of the fact that she was a completely different person coming out of that environment. She was more confident, and I felt like she felt more empowered for the fact that she could come see a dentist, have the treatment done, it gave her more control over her environment, and I felt that she could take that away from her, out of not only the dental setting, but she could apply that same confidence in other areas of her life. So yeah, that was really great to see. And one thing that I really remember from working in the dental hospital, it's not the most encouraging, or it's not a happy story, but it really reminds me of the responsibilities we have as dentists. So this was when I was working in my first hospital post. So it was mainly oral surgery, like I said, but it was a small hospital in Norfolk, and we also dealt with patients that needed biopsies for oral cancer. So we'd work with a larger hospital and do the biopsies for patients nearby, and then we'd send the biopsies off to the larger hospital where they'd have the treatment if it was necessary. And this patient was 30 years old. He was a young dad with 2 children. He didn't smoke. He didn't drink much alcohol, but he came in for a biopsy, and he had a really, really, really large ulcer on his tongue. And you could tell straight away that this was not just a normal ulcer. It ended up being oral cancer. And we had to, number one, do a biopsy on this man who was generally quite anxious. So in the end, we had to put him under, I think we did the biopsy under general anesthetic because he was just so anxious. Did the biopsy, and it turned out to be cancer. And the reason why I can never forget that story is because of the fact that the patient delayed coming to seek help with his dentist because he was afraid. And you just think he himself knew that it wasn't right. I mean, initially, the ulcer would have been quite small, but it got to the stage where it was about a third of his tongue covered, and he wasn't eating. He'd lost so much weight. His wife was extremely worried, but he didn't have the confidence to go and seek help. He was anxious about dental treatment, and I think he was afraid of what would happen, knowing that it didn't look right. And what I learned from that experience was that there are a lot of patients out there that need our help, but for one reason or the other, they're so afraid that they don't actually seek help. And after that experience, it actually made me want to do more. So me and my colleague, we wrote an article about dental anxiety and how it impacts how people seek help, especially in terms of oral cancer. So our job as dentists is not only to treat patients in general practice or hospital, wherever we're working. Our job is to promote dentistry, to try and break down barriers so patients don't feel afraid to come, and also to just educate the general public on things they don't know about. So oral cancer, tooth wear, these things, we're not just called to live in a box, work in a surgery, and that's it. We, especially now with social media, we really have no excuse to just really promote dentistry as much as we can. We can really kind of change the way the general public see dentists. I think that's changing already, and we can all play a part in that.
Awesome. You guys will get an opportunity to probe and ask some more questions towards Dr. Toyin. What we'll do is we'll jump straight to Dr. Aunkit and take it from there.
Hi, yeah, thanks, Arnold. Can everyone hear me okay? Yeah, good. So yeah, hi, I'm Aunkit, and I qualified from Liverpool in 2014. So those 5 years of dentistry are probably one of my favourite 5 years. Uni's like the best time. I'm sure, there was some first years here. They'll tell you how fun it's been. Freshers especially, I've got good memories of freshers in dental school. So yeah, it brings back a lot of good memories. But obviously, coming up to sort of before I became a dentist, I remember the application process was quite interesting. I think a lot has changed since then, but back when we were applying, it would have been probably 2007. We had to sit like the UK CAT exam. So I don't know if that's still going on now or not. I'm sure you guys will be able to advise us. But yeah, I sat that exam and I didn't do too well in it at all. And I think the unis that I wanted to apply to, which were primarily I wanted to go to Sheffield or Newcastle, they looked at the UK CAT. So obviously my score, which wasn't that great, I didn't get offered any interviews from those dental schools. But the one dental school that did offer me an interview was Liverpool. And that was the one that obviously I went to, and unfortunately made me into a dentist. So with regards to obviously preparing for that, as Toyin said, your personal statement, is very important. So the more activities you do, especially extracurricular things, it'll make you stand out from the rest of the crowd. Everyone's going to write in their personal statement that, I want to put a smile on people's faces. I want to, fix teeth. There'll be people saying that, oh, I've had braces before. It's all standard. All the dental schools have heard this before. You want to kind of maybe have a personal anecdote or something that maybe you do in your spare time, some kind of arts and craft, or just something that you use your hands with, that you want to talk about, because that's what they'll pick up on. They'll find something that makes you unique at your interview. And then they'll kind of ask you more about that and just get to know you as a person. And if you've got something that makes you stand out from the crowd, it's you're already winning, basically. Now, I didn't have a lot of things that made me stand out. I think what I did was, when I was at college, my A levels were standard A levels. It was biology, chemistry, maths, Spanish, economics. Obviously I dropped one after AS because I think I was doing way too many there. So I think I dropped economics. But the core A levels back obviously were biology, chemistry, and I had maths and Spanish. So obviously my A levels were okay, but I needed something else. So during the sort of process of applying, I just wanted to do some work experience to get sort of into what the job entails. So my work experience, I went to Royal Preston Hospital, and I did like a week just in the oral and maxillofacial department. Now, obviously, this was probably not the best idea, because when you go into an oral and maxillofacial department, when you go into like the surgical setting, you're seeing a lot of blood. It's not sort of what you see in a general dental practice. But I just wanted to see, obviously, what the hospital side of things involved. So I did that for a week. Obviously, I went to my own dentist. That was way before I did anything. So I went to my own dentist probably in like year 10. This was like way before I'd even got to A levels. And it kind of interested me. I enjoyed the hands-on aspect. I enjoyed I enjoyed looking at the drill and how they were drilling teeth. That was the part that excited me the most. And I think my dentist told me that soon there's going to be all the drills will be sort of laser drills. Now, it's not happened yet, but hopefully one day we'll have lasers in that, and it'll be it'll be a lot more fun maybe. So it just kind of, it made me think that, yeah, dentistry it's going to move forward. It's going to be digital advances in it. There's going to be technological advances. It's going to change, and it has changed since I graduated. And I'm sure Arnold and Toyin will tell you the same thing. Since we've graduated, a lot has changed. Dentistry has become a lot more digital. It's ever expanding. And I'm sure when you go to your interviews or in your application, they're going to be focusing on the future of dentistry. So what it's worth doing is, when I was at college and I was obviously waiting for my interview, someone advised me from my college, one of the people there that was sort of part of the just sort of helpers in advising on applying for dentistry. They advised me to read around modern sort of just articles in dentistry. So I used a website called dentistry.co.uk, which I still use now. In fact, they send loads of articles. And so if you go on dentistry.co.uk and just have a look at a couple of articles, just see what the modern sort of news is on dentistry, just to familiarize yourself with that. Because they might ask you, they might say, what do you think is going to change in dentistry in the next 5 years? And obviously a lot will change, because we've got COVID going on, and it's had a massive impact already on the profession and the work. Some positive, some negative, but the way we behave in terms of our personal lifestyles have changed. And that's the same for dentistry. Dentistry is the number one profession that's pretty much impacted by COVID, because at the end of the day, we're looking into people's mouths, and you know, what's more riskier than that when it comes to catching this virus. So yeah, I read a lot of articles, and I sort of spoke about a few of them during my interview, so it might be worth doing that. Another thing I did was I went to a dental lab. So I went to a laboratory close to my house just to see what it involved in terms of making dentures and crowns and bridges. And at the end of that experience, he gave me a bag full of models, which I took to my interview. I mean, I wouldn't advise you do this, but this is what I did. So I took a bag of sort of wax models and not dentures, but like just sort of little things that I waxed up. Rather than a denture, I think I made like my name on something, like a keyring. But I just showed them that I went to a dental laboratory. I familiarized myself with sort of the wax and everything. And they seemed to like that at the time. So as I said, I wouldn't do that now. I'd probably, maybe if you've made some model or some kind of craft, or if you paint or anything artistic related, they'll like it. So, you know, that's probably what I would suggest. I think I remember when I went to my interview, someone brought a massive painting, like an A1 sized painting, and then they sort of wheeled it in. And yeah, I think they really liked that. So that obviously set her apart from the rest. That was my one memory from my interviews, is I thought, wow, some people are really prepared for this. And you have to be, because it's a competitive field. You know, it's not easy to get in. It's probably even a bit harder now with more and more people applying, but I'm sure we can help you, and you know, we're here to give you advice as best we can, given the fact that obviously things are changing every year. So yeah, I mean, obviously, uni was great after that. Once I did get in, uni was fantastic. 5 years, you know, don't take them for granted. There's a lot of learning to do, but when you do come out of uni, it's not the same when you enter a dental practice. They'll teach you the basics. They'll basically teach you how to crawl, but then you have to learn how to walk and to run when you do actually enter a dental practice. And it's fun. You know, it is fun. It's a good process. You come out of uni and you feel like you're king of the world. You've got this doctor title. You've got the badge that says you're a doctor. Put it on Instagram, put it on Facebook, and just embrace it, because that's the best thing you can do. Because you will feel like, you know, you've made it. It's the best feeling. I still remember my results day. Every year I'll remember my results day, and I'll remember my graduation day. And it's just that feeling that you made it that day. It was probably, it'll be the highlight of your life by far and beyond. And then afterwards, obviously, reality hits that you become a dentist, and you're going to be looking into patients' mouths for the rest of your life. But you know what? It's good, because you come out, you go into practice, and your first day, you'll feel like, you know, you're going to be very nervous about it, but there's nothing to worry about, because you've done this. You know what you need to do. It's just applying it. And you got to remember, obviously, when you're dealing with patients in the dental school, it's different, because they hold your hand with every patient. They will walk you through all the steps. But when you go into practice, you are on your own, essentially. You will get lots of help and advice, but you are on your own. So you got to be, obviously, as Toyin said, you got to think on your feet. You got to prepare for sort of problems that will arise. And the main thing really is just managing patients. You will be looking at teeth, you'll be looking at gums, you'll be looking into mouths, but you got to manage the patient as a person. If you don't talk to them properly, and this is the one thing I find, is patients come to me from different practices and they'll tell me, I went to so-and-so dentist and they just didn't listen to what I said. They just pulled a tooth out, or they did a filling and I told them it wasn't this or it was that. And it's communication. That's the key here, communication. As long as you communicate properly. The other thing is that you've got to be a people's person. I can't imagine a job where I don't deal with people. For me, I can't sit behind a computer. Now, obviously in dentistry, you're going to be sat behind a computer a lot because of the amount of notes we have to do, the amount of record keeping we have to do. But obviously, it's the aspect of dealing with many people on a daily basis is what gets me through the days. And I'm sure Toyin and Arnold will agree, but the days go so quick. You don't feel like you're working some days. It's just, you're just dealing with people. You're doing the clinical aspect, which is a bonus, but it's the fact that you're managing people, and, you know, along the way, you'll make friends with some patients. You know, they'll bake you cakes and they'll bring you sweets. And, you know, that's the best part. They bring you chocolates. You know, there's loads of things that they'll just make your day. But for me also, I enjoy working in just a general dental practice. I like the variety rather than just dealing with one aspect of dentistry. Like, I wasn't keen on specializing in one area. I know Toyin says she likes all the areas. I don't like all the areas. That's why I didn't want to specialize in one area. For me, there's certain areas I do like more than others. I do like sort of orthodontics. I know Arnold's keen on that as well. I'm sure we can give you some information on that. I like cosmetic dentistry. That's sort of where things are moving at the moment. A lot of digital cosmetic dentistry. You'll hear lots about it. And I think that's that's probably what's going to inspire you guys now, is the digital aspect of dentistry. It is expanding so quickly. Things are just done so differently to how they were used to when we came out of dental school. And for me, that was only like 6 years ago. So there's a lot of changes happening, and I think there's a lot to look forward to, really. I think you guys, you know, hopefully the COVID situation will stabilize. I'm not sure when, but when it does, you know, it's going to be a really good time to enter dentistry. So I did a year of Max Fax, which was very, very interesting. I think after uni, obviously, you go through your foundation year. Um, and then it sort of prepares you for what practice life is like. Now, I didn't want to enter practice too quickly. I wanted to get some experience of different sort of settings where dentists can work. I was recommended to do prison dentistry, but I didn't get a chance to do that. But I know someone that does do prison dentistry, and then they say it's quite fulfilling as well. So I did a year of Max Fax. So you're looking at, you know, facial trauma, oral cancer, pulling out lots of teeth. And it was very, very rewarding, very, very sort of interesting to see. You see, you know, everything to do with the head and neck, and it was really, really good that year. So I would recommend, after you do finish uni, I would highly recommend you do what they call now a DCT year. And if you want to specialize, it's essentially you have to do DCT, I think 3 years of it. But if you're not sure what you want to do, then it's highly recommended to do that. And I think Toyin had some good experience. She managed to do all the different specialities during her DCT years, which I'm sure she could advise upon. But I can give you some insight onto Max Fax, which was a very, 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 very fun year. I enjoyed working in a hospital. You know, you get a badge that says you're a DCT doctor. And yeah, you get a card which you can use as Nando's, because we didn't actually get any for NHS sort of card as a dentist. So that was the first time I actually had a card that I could take to Nando's and say, yeah, can I have a 20% discount? So that was quite good. So yeah, at the moment, after I did my hospital year, I went straight back into general dental practice. And I went on lots of courses. So there's loads of courses out there now. And this is what sort of teaches you real dentistry, cosmetic stuff, and anything else you're interested in. There's courses for everything these days. So you just, you know, it maintains your knowledge, and you'll learn lots more things that you didn't get to focus on at dental school, because they only teach you the bread and butter really at dental school. And then it's up to you to obviously go out and enhance your knowledge, and just sort of learn what you enjoy the most, really.